when it comes to just looking at young docs coming in. And again, I am involved in terms of the new doc recruitment in Connecticut, working along with Tom Hurley, who's our head of recruiting. But I am speaking to these folks, also vetting them in terms of their references. And it is really, really important to us to be recruiting docs that are not just accomplished in terms of their studies, their clinical abilities, but absolutely essential that they be decent, down to earth folks, because it's just fundamental in terms of just keeping that atmosphere and preserving the issue of mutual respect and appreciation for what everybody does. It's a very, very important part of the recruiting process. They do like the idea of joining. They very much like the idea of joining a group practice, by the way, in terms of having just on a day-to-day basis. They like the idea of having other docs to essentially to bounce things off of and so forth. The culture of, and again, this is a bit of a hackneyed and overused phrase, but the issue of a team. Private equity may or may not be, as ReFocus has been, very, very motivated to promote that concept across the board in terms of everybody who's in the office, whether it's a front office or whether it's in the clinical arena. And they certainly support continuing education and just really a collaboration among everybody, really not making distinctions between technician and perhaps an optometrist is in the practice or the MD. Bottom line being that everybody is really treated and needs to be treated with the same kind of respect and also sense of appreciation in terms of what they're doing. One thing that I do think ReFocus has been very committed to is having the docs in that individual practice sign off on any new people coming in. That's really important. And I'll just mention again, working with Tom Hurley in recruiting right now, we've had a few candidates who just the existing docs in the ReFocus practice have basically just not wanted a candidate or two that might have been vetted positively, but they just felt that it just was not the right person. And that will take care of, that will essentially trump any of our recommendations. And I should say again, any kind of hiring right now is really dependent on that individual practice.
Work-life balance is incredibly important. Most of us are not based in a hospital. We're based in a private practice setting. That's where the majority of eye care is around the country. And I truly believe that balance was important for me going into this venture with ReFocus. And it's been preserved for sure a year and a half now into this deal that we did in Northern New Jersey as Ellipse. So the ability for physicians to be autonomous, to do what they do best historically, that has not changed whatsoever. And that's exactly why we did this deal with a company like ReFocus. They have not macromanaged. They've helped out with some of the HR parts of running a practice and some of the mundane parts that otherwise we did not enjoy. And in eye care, adopting that mindset, I think what I do today is much different than what I did even 5 years ago, 10 years ago, for sure 15 years ago, whether it's cataract surgery or MIGS or minimal invasive glaucoma surgery, or even how I treat dry eye patients, or using amniotic grafts, or using punctal plugs. We've come a long way, and our specialty is a very fun specialty. Patients adore something that's going to make them see better and really improve and enhance their vision, and innovation is a very, very big part of that.